It's difficult to tell whether an unconscious person is choking or entering cardiac arrest. Rescuers should follow the check, call, care steps learned in CPR. Unconscious choking is determined during the breathing portion of the airway, breathing, and circulation check. Step 1. Breathe. After opening the airway, rescuers should give the victim 2 breaths. If those 2 breaths do not go in, the victim may be choking.
What if the air doesn't go in? That could indicate one of 2 things. Maybe it is our fault. Maybe we didn't tilt the head back enough, or maybe the person is choking. How can we tell? If the air does not go in, we're going to try to give him 2 breaths again.
Step 2. Compress.
If the breaths still do not go in, that indicates to us that the person is choking. So we're going to do compressions. We're going to go ahead and do 30 compressions, just like the CPR compressions.
Step 3. Look.
Then we're going to look in the mouth. We're going to open the person's mouth with a thumb.
Step 4. Sweep.
With the hand that was on the forehead, if we see something, we're going to dig the item out.
Step 5. Breathe again.
We're going to give the person 2 breaths. If the air does go in, for a child or infant, we're going to proceed to check, like we did before, check the pulse and breathing, and then decide what step is going to follow. For an adult, once the breaths go in, we are going to look over the body, look for signs of life, and if there's no signs of life, we begin CPR.
Step 6. Recovery. If the victim shows signs of life, place them in the recovery position and wait for emergency personnel to arrive. Knowing the difference between an unconscious choking victim and a victim in cardiac arrest is important, so we recommend you take a class and review these steps often.